Suctioning and tracheostomy care. First is check the order very well. Then, assemble equipment in the utility room. First is open the tray, pour sterile water on the bowl. Then sterile Zephyran in one bowl. Pour an SS in another bowl. Pour an S in the medicine glass. Open package of catheter and put in one bowl and close the tray. And bring equipment to bedside. Introduce self and verify client's identity.
Ako balik si Mary Gisette Navarra. Ako ang nurse mo subong adlaw. So ano ka name ta?
Christine Gonzalez.
Okay. So ma-check lang po i-verify ko lang. Okay.
Explain to the client the procedure, why is it necessary, and how the client can cooperate.
Ako ng space, then need ato ng suction para makuha ang inyong mga secretion nila. Okay?
Perform hand hygiene. Then provide for client's privacy. Make patient assume semi-sitting position and put towel over the chest. Set the pressure on the suction gauge and turn on the suction. Next is put on sterile gloves, non-sterile on non-dominant hand, and sterile glove on the dominant hand. With your sterile glove hand, pick up the catheter and attach to suction unit. Advance the catheter into the inner cannula about 6 inches. Then apply your finger to suction control port to start suctioning. Gently rotate the catheter. Apply suction for 5 to 10 seconds while slowly withdrawing the catheter. Then remove your finger from the control and remove the catheter. Rinse and flush the catheter and tubing with sterile water or saline. Repeat suctioning until the air passage is clear. Then stop suction machine and disconnect catheter from suction unit. For tracheostomy care, first is open tracheostomy tray, wash hands, and dry. Then look for the tube and pull inner cannula outward gently. Tell patient to maintain as much as possible the same position. Put inner cannula in one 4x4 sponge. Bring it to the utility room in a sponge and one extra sponge. Rinse in cold running water. With 4x4 sponge, roll to fit the opening of the inner cannula. Push it through, leaving 1 inch on both ends. Rub sponge on the lining of the tube by pulling it back and forth. Then wash inner cannula with soap and rinse. With extra 4x4 sponge, wrap the inner cannula and bring it on to the patient's room. Place it in a bowl with Zephyran for cleansing. Pick up inner cannula with forceps and place in a container with sterile water. Pick up inner cannula with the forceps and shake until it is free of water. Dry in 4x4 sponge. Using the same sponge, pick up the inner cannula and place it back through the outer cannula and lock. Remove the dressing around the tube with one hand pressing the tube gently in place. The applicator, moistened with NSS from the medicine glass, clear site around the tube. Repeat same procedure until area is clean. Try it with cotton balls. Careful that no thread of cotton enters the inner cannula. With the forceps, hold one 4x4 sponge and with the scissors, cut the sponge forward center almost half. And with the forceps, hold sponge on both ends and fit the cut edges to enclose the tube. Fix the patient.
Okay naman ang pumatsyag mo. Okay. So, wala ka naman napatsagan ng ibang pa. Okay. So, kasi siya pala. Thank you.
And record.